I'm Michael Smith of MedPage Today, and I'm in Rome at the 2011 conference of the International AIDS Society. I'm speaking with Dr. Robert Grant of the University of California, San Francisco, who was the principal investigator of a major trial, the first trial to show that pre-exposure prophylaxis for HIV actually could have an effect. That's the so-called IPREX trial. Dr. Grant, that trial reported some time ago. You're here now sort of essentially telling people what the long-term results have been, what the wrap-up has been of the blinded part of that trial. Am I right?
Yes, we're happy here to be presenting new information about how the trial ended. Our primary report was based on information we collected through the middle of 2010. And that information indicated that PrEP provided 44% additional protection to men who have sex with men who are receiving a comprehensive package of prevention services. So that's 44% additional protection above and beyond condom promotion and treatment for other sexually transmitted infections. I mean, we were providing people with everything that we knew how to provide for helping them protect themselves. And PrEP added an additional 44% protection. But it was better than that. Among those who actually took PrEP, the decrease in HIV risk was more than 90%. And so people were protected if they actually were able to use the pill. And about half were able to do it. So we're happy that people were able to take steps to protect themselves and remain free of HIV. Now at this point, we've completed visits through February of this year, and we're confirming that this really did work, especially for those who took the drug. And we've been able to analyze many more specimens, many more data. And we're really now confirming that the protective effect of having PrEP in the body was approximately 90%.
So if people were taking the drugs, and you're confirming this by testing samples to see if
Yes.
there is in fact drug in their system,
yes,
then their risk is reduced on top of using condoms and getting counseled and all the rest of it by 90%.
That's right.
That's quite dramatic. And this was a population of...
So it's a population of men and trans women around the world. We had study sites in Asia, in Africa, Brazil, the Andean region of South America, and in the United States. They were mainly young people. The average age was 25, and so half of our cohort was between the ages of 18 and 25. And this is a group that is at very high risk of acquiring HIV, and in the past has been difficult to approach them. They have a lot of things on their mind. There's a lot of social things that they're doing, and getting them involved in HIV prevention has been difficult, but we were able to find that this was effective for young people as well as older men and trans women.
And let's follow that up just a bit. The CDC has come out is working on, has given sort of initial guidance. What can you tell doctors and their patients who have read about this trial and will read about it in association with our chat? What should they be doing? Should they just be going out and getting a pill if they think they're on high risk, or what?
Well, I think that the first step is to open the discussion and to make sure that individual patients and people they know realize that there's choices now, and that HIV is not something that you can just hope will not happen. It's something that you can actually take steps and do things to keep it from happening. And so I think the conversation is really the first step. Have a conversation about HIV and sex with your patients and with other clients that you have receiving services from you. That's step one. Step two is to make sure that they realize that there are many options. Condoms are still very effective. They prevent not only HIV, but they prevent other sexually transmitted infections, and they prevent pregnancy if that's an issue. But for many people, consistent condom use is not something that they've been able to do. In some cases, it's not something that they've decided to do. And so something else is needed. And I think that we can say that a daily oral emtricitabine tenofovir, otherwise called Truvada, is effective in decreasing viral load, but it has in decreasing the risk of HIV infection and viral load. And but it has to be taken consistently. Which doesn't mean that you can't miss a dose ever. It is a forgiving regimen. People should try to take it every day. That's what we studied. That's what we showed was effective. But if they miss a few doses, it's no reason to give up on the idea. It's still highly effective and when used in combination with efforts to use condoms and other things. So I think that there is interim guidance from the CDC. The FDA in the United States is reviewing information from our trial, and we hope that they'll make a regulatory decision later in the year. In the meantime, physicians in the United States can prescribe this off-label for prevention if they have people who are saying that they are not able to use condoms consistently. I think that that's the most important thing. If people say, I'm not really sure that I'm always going to be able to use a condom, or if they say, I'm not using condoms, I think that's going to be the person who needs and will benefit from PrEP the most.
I see. Well, Dr. Grant, thank you for speaking with us. In Rome, I'm Michael Smith, MedPage Today.